Hello everyone. My name is Justin Wu. I'm a freshman med student at the University of Missouri Kansas City, and thank you for tuning in to our KAMSA podcast entitled Beyond the White Coat. With me is Justin, and you want to give a quick introduction, Justin?
Yep. Hi, I'm Justin, and I'm a second year medical student at UCLA, and I'm also part of KAMSA, and I'm looking forward to this interview. Of
Yeah, and Justin, you want to introduce our
course.
guest, Dr. On?
Yeah. Dr. Ahn, can you give us a brief intro on your background as well as what you're currently up to today or to this day?
Sure. So my name is Sanghoon Ahn. I'm a medical oncologist practicing at USC Norris Cancer Center in Southern California. I'm the director of the two ambulatory clinics, one in Koreatown in Los Angeles, and then the other one in Buena Park in Orange County. So our Norris Cancer Center has several ambulatory clinics. It helps better access for our cancer patients to come to us. So we have multiple sites, and I'm the director of two of those places. I was born and raised in South Korea. So I was raised in a Christian family. And when I was growing up, I always felt that I needed to help other people, people in need. And then through my religious belief, I got interested in medicine because I wanted to become someone who can help others, not just physically, but like psychologically and mentally. And then naturally, I became a physician. And when growing up, I wanted to one day become a medical missionary, like serving in like some developing countries. And naturally, I wanted to be able to become a physician who can do everything. So I went into family medicine. I finished my training back in 2001. And after I finished my training, I had a chance to work at the National Cancer Center in Korea as a family physician. And there I saw a lot of cancer patients, and I saw like cancer patients going through very difficult, tough times, but that really got me interested in cancer itself. And also, it was during that time when the newer like target therapies and immunotherapies, the newer developments in cancer were really surfacing at the time. So I became very interested in oncology itself too. I was interested in research and advancing the field. So I wanted to become an oncologist. So I debated whether to stay in Korea or move to the United States. And then I decided to move to the United States. So I came to the US in 2002. So yeah, so that's why right now I'm working as a medical oncologist in the US.
All right, thank you so much for the introduction, and we got to know a bit more about your upbringing. So I wanted to ask, so how did your Korean American background influence you as a physician, and do you have any key moments or highlights that you want to mention in your journey as a Korean American physician?
Yeah, so ever since moving to the US after I finished my training, I stayed at University of Arizona 1 year as a faculty as a GI medical oncologist and also focusing on clinical trial, phase one clinical trial. I had my relatives living in Southern California, and I heard about a huge community in Southern California. But because of language and cultural barrier and like access issues, I had my maternal grandma living in SoCal, and I know she was kind of struggling, getting quality medical care. And so I really thought about maybe I should like relocate to Southern California where there's a lot of Korean Americans and there's need because of my language and cultural and educational background. So I decided to move to California. So I moved around 1998. Yeah, and ever since moving from Arizona, I found this like 500,000 large Korean American community, and there are only like handful of Korean speaking medical oncologists. So naturally, it really opened doors to many like practice opportunities. I was recruited aggressively by different like specialty, different medical groups and so on. So it kind of became, being a Korean American became really one of the greatest strength for me because there was this huge community of Korean Americans. And in 2011, I actually opened my own medical and radiation oncology practice, both in LA and Buena Park. And the practice grew really rapidly. And I think I was seeing maybe something close to like 50% of all the Korean American cancer patients in that area, because I was like one of the very rare groups. We had all our physicians were Korean Americans and our staffs also bilingual. So we're very popular. And then I got in touch with USC, and USC is very close. Their main campus is very close to the Koreatown. So they're interested in the Korean community too. So, we kind of met, and then I actually sold my practice to USC because I realized that in order to provide the best and most up-to-date care, especially like access to clinical trials and multimodality treatment, I needed to be really part of a larger academic system. So I brought all my practice, all my family to USC. This was 2018.
Oh, Justin, you want to ask the next question?
Yeah, sure. Well, yeah, thank you, Dr. Han, for sharing that story. That was very very impactful. So I guess kind of going into leadership, kind of can you share some challenges that you encountered as an Asian American, kind of pursuing medicine here in the U.S. Because as you mentioned, that there's really not many kind of Korean American oncologists. So I was wondering if you can share kind of some stories or some challenges that you faced along the way.
Yeah, so because like I was trained in Arizona, and Arizona, the Asians are truly minorities. There are very few Asian in my residency program, and also like the whole hospital and the academic system. So, I did feel that, I was kind of the minority, and sometimes my voice didn't seem to carry the same weight as the mainstream physicians. But ever since moving to Southern California, I never really had any moments that I thought I was kind of at disadvantage because I'm an Asian American, because we have such a huge presence here. And as I said, there are like 500,000 Korean living in this very populated area of LA and Orange County area. So there are a lot of moments when I was kind of representing, like as a Korean physician, the whole community. So I never really felt challenges ever since moving to Southern California, to be honest.
All right, thank you so much for sharing. And a follow-up question to learn a little bit more about your journey. I was wondering if is there anyone that inspired you or someone you looked up to, especially since like when you started back then, there weren't that many Korean American physicians. Is there any role model?
So actually, it wasn't a Korean American doctor. Actually, it was an Indian American doctor who was a role model for me when I was in Arizona. So, when I moved from South Korea to Arizona, of course, I had like language barrier myself too, because I didn't speak English for a long time. And of course, there was like this cultural barrier, because like Korean hospital system and the U.S. system was very different, and I was repeating my training at an older age. So these are all like very difficult things for me. And this Indian medical oncologist who was a faculty at University of Arizona really helped me out, because he himself was an Indian medical oncologist. Then he went to Harvard Medical School, and he went through all this training, so he knew like what it meant to be an immigrant physician. So He really led me in many different ways. He was my mentor as a medical oncologist, and he really helped me actually get into the University of Arizona Medical Oncology Fellowship Program too. So I really look up to him, and he's the one actually kind of showed me what it means to be an immigrant physician, and what kind of like responsibilities and roles I can play.
Yeah, yeah, definitely. Kind of having a mentor and things like that, especially coming over from a different country into the U.S. Is very important. I was wondering if you can kind of share, since you mentioned that you were kind of the main contact point for a lot of Korean American patients, especially in Arizona and also in California. I was wondering um, how you kind of adapted to that role, especially it seems like it'd be a lot of pressure and a lot of kind of responsibility to care for a large amount of the Korean American population. So I was wondering if you can share some wisdom or anything about that in that role that you have.
Yeah, so at USC, as I said, I'm often seen as the representative, so to speak, for Korean patients. And so whenever something involves anything like Korean comes up, the hospital will come to me. So like any like radio or TV interviews, like YouTube interviews, writing like Korean newspaper articles, or like you have like guests coming from Korea, whatever, they come to me. And I actually enjoy it because I'm kind of really helping out my community in that way. And I also enroll probably the highest number of Korean American cancer patients into clinical trials, which is super important because when we develop new drugs, of course everything has to go through clinical trial, and it's very important that we have a good Asian American representation in the clinical trial because then the drugs that are developed, the dosage, the side effects, and all those, the Asians will be represented because Asian Americans and Caucasian, Hispanic patients and African American patients, they all have different metabolism. They have different cancers that are more common, and so they respond differently to different drugs. So if we don't have that Asian Americans included in the clinical trial, it might not represent us. When we actually use the drugs, we might be, giving them too much. The dose is too strong for Asians compared to the Caucasians. So we really want to have representation of our Korean Americans or Asian American, in a larger scale to be in the clinical trial. And I am actually kind of proud to say because I enroll a lot of Korean American patients in clinical trials. So my hospital actually acknowledges me for enrolling the most number of Korean Americans out of all the like hundreds of faculties. So to me, like representation, it's not just something that's symbolic. It really is ensuring our community are included in the research data, and the decision making and so on. So it means that our patients are really seen and then valued. That's what it means. Representation means to me.
All right, thank you so much for sharing. And that's impressive that you were the number one enroller for all Korean American patients. And as a follow-up question, I wanted to ask, can you give a little bit more about your patient experience as well as like how you're able to convince them to enroll in trials and like what your day-to-day is like with Korean American patients?
Yeah, so my clinic, on purpose, we hired almost 90% of our staff, including physicians, are bilingual in Korean and English. So when my patients come to my clinic, they feel comfortable because for them, just making that initial phone call to make appointment is a lot of stress because to them, especially most of my patients are elderly patients, right, over the age of 65, because cancer incidence is mostly higher in elderly patients. And if you say hello, then it becomes a stress. So our staff answers in Korean, And when they come, they're greeted in Korean and very culturally familiar environment. They're very welcomed. So I think those are very important aspects of the clinical care, not just the medicine, but the environment, surrounding environment too. And we, because we see like 80% of our patients are Korean Americans, we know our patients' cancer. So what I mean is, for example, like gastric cancer, it's still very common in Korean Americans, but it's not very common in other ethnicity, like especially the mainstream, so to speak, like Caucasian, Black patients. It's not very common. So gastric cancer is overlooked. There's no like screening recommendation for upper endoscopy. But in Korea, mainly in Korea, everybody is screened starting 40 with upper endoscopy every 2 years. And they find stage 1 gastric cancer. They catch gastric cancer very early on in like over 60% of the cases. So naturally, their survival is much higher. And we know that. So, when patients come, we don't just go through the regular screening recommendations, but we also focus on the common cancers for Korean Americans. And that's very important, caring for our patients. And, we have more experience in knowing like how Korean patients respond to different types of treatments. And then the other thing is, so they're culturally different too, because many of our senior patients, they want their family to be involved in important decision making. So, for example, some of our senior patients, they ask me to ask their children, their sons and daughters, help in making this important decisions for their cancer treatment. So, most of the Caucasian patients are very independent. They want to make their own decisions. But Koreans, you do have to respect their culture, that their like family is very tight and they have a strong supporting system, and you have to understand how the family dynamic works and really try to understand the patient, him or herself. And last thing I want to mention is Korean patients don't really like going on clinical trials because they still have this impression that clinical trials are like just testing new drugs and you're kind of like a guinea pig. That's a desperate last resort, which is not, because a lot of these new exciting drugs are approved through the clinical trials, and clinical trials are like it's a safety monitored like structured treatment. So there's control group, there's treatment group, and you're not just kind of being tested, but you're tested in an ethical manner. And this is the only chance to actually this is actually the first chance to get the newer treatments. So I try to explain that to my patients all the time. So I talk to them about the clinical trials from the get-go, from the start of the treatment. And every time when we have a need to change the treatment, I always mention clinical trial as an option. And I tell them that, being able to go on clinical trial is one of the privilege of being treated in the university system versus, the community settings. So I try to really encourage them. And I also mentioned, as I said, we need to really represent our Korean Americans in the clinical trials. And this is not just for you and your family, but for the whole community. So I really consider clinical trials very important. And most of my patients, by the time they decide to go on clinical trials, they already heard 4, 5, 6 times about this from me anyway. So it's much easier for them to make that decision and transition to clinical trial.
Yeah, thank you for sharing. And yeah, congratulations on being kind of awarded for from UCLA or USC. I apologize for having the most enrolled in clinical trials. That's amazing. Um, so I kind of want to ask, what would you say would be kind of like the most important aspect of kind of treating Korean American patients compared to like the general population that you would like to see kind of more incorporated into other practices that may not have a focus on Korean Americans?
Yeah, so for the Korean Americans, as I said, the language and the cultural barrier really is very important because the patients have to feel comfortable coming to you. Well, when you're diagnosed with cancer, that's already huge stress in and of itself. And if you're going to a physician or meeting staff members who don't speak your language and who really don't understand you, becomes even more difficult. And that's sometimes the reason why they avoid going, seeking medical care and attention early on. So I think it's very important that we have that cultural language aspect. And accessibility is also very important because that's the reason why we have our office in Koreatown in LA and Buena Park in Orange County, because that is where the largest number of Korean Americans reside. So it's very easily accessible. They don't have to drive like an hour, 2 hours. It's only like 15, 20-minute drive, and you have access. And you really need to understand the cancer in that population. So, you know, different ethnicity have different types of cancer, and they have different responses and different incidences of different cancers. So you really need to understand the different population. And because United States, it's a diverse community. There are a lot of different people from different backgrounds and ethnicities. So being a medical oncologist in the United States means that you kind of have to understand how like all these people are different. Because when I was a physician in Korean Americans, like 100% Korean patients, I didn't have to worry about anybody else. But here, because even though I mainly see Korean Americans, I still do see other ethnicities. So it's important that we kind of continue to study and update ourselves and really acknowledge the differences between different ethnicities.
All right, thank you for sharing. And this next question, I kind of want to ask for the future generation, especially since you had like extensive tenure with your medical career. So I wanted to ask, do you have any advice for any medical students today or Korean American medical students entering medicine, especially with embracing their identity and thriving in their careers?
Yeah, so I'd say, find your niche. I think as if you're going to say you're Korean American physician, I think the language is very important. So learn the language as much as possible. I know it's not easy, because if you grew up in an environment where you mainly use English, or it's hard. But still, like for the Korean American patients, even if you don't speak fluent Korean, the fact that you can understand still means a lot because they're very used to just speaking Korean, and the physician kind of understands, and the physician speaks back in kind of like mixed Korean and English. They still like that. They still love it because they understand that the physician understands you better. So I think so. You really need to learn the culture and the language, and especially living in Southern California or any communities where you do have a number of Korean Americans, that's really that's an asset. That's really a strength. So you really don't have to be shy, and especially nowadays with all this like K-pop and K culture, which has impacted the community in many different ways. I think it's impacting medicine too. So nowadays, like it's made Korean identity like more like visible and like respected in the US, because like if you think about it, like 20, 30 years ago, you know maybe some of our Korean American descendants were kind of like shy or maybe try to hide because you're afraid like how you're seen by the mainstream people. But nowadays, like Korean Americans are, I don't think they're seen, they're no longer seen just a part of a minority group, but as a part of a culture associated with excellence, like innovation, and like global influence. So I think it's important that we take pride in this, and I think that can be carried to the medicine too. Have confidence, and you don't have to like hide your background or like and be shy about being a Korean American. I think can embrace being Korean and be willing to more like speak up and lead and advocate for the Asian American minority. And nowadays like diversity is considered very important in medicine too. So be really confident and be proud. That's I think that's important.
Yeah, thank you. Thank you so much, Dr. Han. I really appreciate you sharing your wisdom and all your advice today. Was there anything else that you would like to share with the Korean community?
Yeah, so like going forward, I'm actually kind of dreaming like a practice where I don't just treat cancer patients, but I want to provide like the prevention guidelines, the screening, the treatment, then like the survivorship care. So the whole spectrum of cancer care in one place. And that's my actually dream and goal. I'm still trying to think how I can do that, but because most of the cancer care as a medical oncologist is focused on treatment, but the prevention and screening, I think, is actually much more important because once you have the cancer, then there's so much resource that has to go into treating. But if you can prevent it or catch it really early, then you can easily cure the cancer with a minimal invasive treatments. So we'll see where where what's going to happen in the future. But I really dream of being able to provide this like prevention to end of life care, the whole spectrum of cancer care in one place, one stop for our Korean American community. So yeah, so we'll see.
Yeah, that's awesome. I'll be Justin and I will be rooting for you. And yeah, definitely kind of going back to your point about how Korean culture it's a lot it's pretty mainstream now. I feel like every time I go on Instagram or TikTok or something, you always see a new K-beauty product or another K-pop group coming up. So yeah, it's we really appreciate your all your wisdom and your advice. Um, Justin, do you have anything else to add or any other questions?
Yeah, I'd just like to thank you, Dr. An, for being, just our word of wisdom for the next generation of Korean American physicians. So hopefully everyone that listens to the podcast is able to like gain the understanding of like how to compassionately work with different communities, especially the community, Korean American community. And I guess one last question I wanted to ask is just knowing what you know now, is there anything that you would have done differently or anything that you feel is important that you wish you would have addressed earlier?
You mean in the United States or like during my med school years or?
Or it could be throughout your medical journey or just in the United States, whatever you prefer.
Yeah, so I mean, I was actually trained in family medicine first and then became a medical oncologist. So my background is a little different. And I think that really helped me a lot in becoming like a more comprehensive medical oncologist. Because when cancer patients come to me, they don't just talk about cancer. They talk about many, many different things. And sometimes they bring up diseases that could be unrelated to cancer, something, totally different. And if I was just trained mainly in oncology, maybe I can't really provide that comprehensive care, like the whole person care. But because I do have this family medicine background, I think I have a better understanding and really helped me become a better clinician. So I know, a lot of our students, you have very different variety of different backgrounds, right? Right? You come from like some people come from humanities, social science. Some people play violin, some athletes, and I think that's really great. So I meet some of my students say, "Oh, I think I wasted so much time like gap year." Or, no, you're not wasting your time. All those experiences that you've built up, that makes you become who you are and how, you as a unique physician. So really be grateful for those experiences and because they're not waste of time. So really try to learn, try to utilize every moment that you learn, even if it's not like directly medicine related, because it really makes you a complete person, a physician, And patients, when they look at you as a person. They don't look at you as a cancer treating machine. So I think that will really build you up as a really cool physician who truly understands and can relate to the patients.
All right. Thank you so much. Justin, do you have any last questions you want to ask?
No, I think yeah, we pretty much hit it all. Thank you, Dr. Ahn, again for your time and for joining us today. We really appreciate everything you shared and your story and your wisdom. So yeah,
Yeah,
thank you so
thank you
much.
so much for inviting me. So, hi
Of
team.
course.
All right. Thank you
Yes.
so much.
Thank you.
All right,
Um,
thank you, thank you.